Thank you all for coming this evening. My name is Joseph DiMarzo. I am the Deputy Commissioner of Social Services, Mental Health, and Youth Bureau for the county, as well as the co-chair of the Communities That Care Coalition.
And I'm Kristen McConnell, and I'm the director of the Putnam Council on Alcoholism and Drug Dependence, and I'm also the co-chair with Joe of the Putnam County Communities That Care Coalition.
I want to thank a few people for inviting us this evening. I think it's a wonderful opportunity for the community as well as for us to share information about our community, about our children. I believe that education and awareness is the first step to change, and I think this is a very big step. I'd also like to thank Dr. Diana Bowers, the superintendent of the school district, who has been a wonderful partner in our coalition. Certainly without her contributions, we wouldn't be as far as we are. And there's many other people in the community who have certainly contributed to this. Our county legislator, Barbara Scucciamaro, and then a lot of the residents, the PTA, PTOs. And it's important that the community understand where we are as we want to move forward with changes. That being said, I'll have Kristen share with you the survey process, and then we'll go through the survey results. Please feel free to ask any questions as we go forward based on what we present. Afterwards, we'll be happy to answer any other questions, and Kristen and I will stay after for a brief period of time to answer any questions you might have that you would like to do privately and not on the air. So thank you for having us, and let's get started.
Thank you. I'd also like to thank the PTA and Lourdes Lafer for helping put this together and make this happen this evening. So what we're going to talk about today is a 2014 Prevention Needs Assessment Survey. The survey was done in the springtime at all 6 school districts in Putnam County, grades 8 through 12. Okay, 1 second while we just do a little tech test. There we go. So we're going to talk specifically about the Haldane results tonight. So there were 363 students in grades 8 through 12 that are in 2014. Of that, 318 completed the survey. That's an increase from 2012, where 263 students completed the survey. Just to give you an idea, in Putnam County, there's nearly 4,500 students that completed the P&A. It was conducted in classes that all students take, such as English or physical education. It has 119 questions, and it's passive consent, which means that we, through the schools, a letter or notification goes home to parents advising them the survey will take place, and it's up to the parents to opt their child out if they wish for them not to participate in the survey. Okay. So just to give you a breakdown of completed surveys by grade, as you can see here from 8 through 12, the highest number being in the 10th grade, with 76 students completing the survey, and then a breakdown by gender, 165 males and 150 females. Okay. This is really important, the confidentiality, validity, and reliability of the survey. Students can skip questions and they're not required to finish the survey. They're assured the survey is voluntary, anonymous, and confidential. And surveys are limited when the students or responses were determined to be dishonest, or because a student does not answer enough of the validity questions to determine whether or not they're honest in their responses. The final question of the survey asks how honest you are. If they answer dishonest, their survey is thrown out in its entirety.
One of the things that we're very comfortable with, we've done a lot of research on these surveys, are that they asked children the same question in 2 or 3 different places. And if the child isn't consistent in their answer, then the survey isn't valid. And so we really are comfortable that these surveys have validity. If anything, based on some small focus groups that we hold with young people, if anything, some of this data is underreported. And so we're really comfortable with the accuracy of the results that we use to move forward in our process.
There's even the fictitious drug in the survey, so if they answer yes to using that substance, the entire survey is thrown out. So like Joe said, we feel really comfortable, and we actually have outside evaluators that compile this data. Joe and I don't do that. We present it after it's been compiled. So an overview of the surveys received in Putnam County, just to give you an idea as a whole. So like I said, just over 5,100 surveys were completed. These are received reasons why they were discarded. So as you can see here, 191 used more in 30 days than their lifetime, which would be nearly impossible. 154 admitted to being dishonest. 467 used a fake drug. 338 used more than 120 times in the past 30 days. Again, an exaggeration. And 105 had an age improbable with a grade. So on the front page of the survey, when they're filling out the basic demographic information, they put that they're in the 8th grade and that they're 19 years old. So we know, again, that they're not taking it seriously and it's thrown out. Yes?
You included tobacco, and if someone smoked 4 cigarettes a day, that would equal 120.
I'm sorry, could you stand up and I had trouble hearing you, and then I'll repeat the question for the camera.
It says 338 used drugs more than 120 times in the past 30 days. And I was saying that if somebody smoked cigarettes, 4 cigarettes a day for 30 days, that would equal 120 times, and that is possible.
Right, but I think when they talk about tobacco use, it's not spoken about on one cigarette is like using a substance once a day. I believe it's used in a more general term, and the questions are very specific. So I understand what you're saying, but I don't believe that that's an issue. Okay.
And we can look into that and see if what you're asking is how they measure that particular question.
Right.
And the question just was about number of use of cigarettes in a 30-day period.
Right. Okay, so we're going to go into the 30-day use of alcohol.
Okay, now we'll start the statistical piece of this. And what we have done is we do this survey in 6 school districts in Putnam County. We do not compare any community versus another community. We have county data. We do not do comparisons. Each community is unique based on its demographics, but I can tell you based on the survey results that each of the communities are basically plus or minus 3% of each other. Our demographics across the board are basically the same. We have few outliers in every community. And we look at that specifically within that community of why is that so different and how do we learn from that? Because some of those outliers are positive and some of them are negative. And if there's something being done in a community that's positive, that has a positive effect on our children, we want to bring that to other communities. If there's a negative effect based on the surveys, we then want to share that so that we then can do that. But we will not compare anyone's community. It's inappropriate. It's not fair. And that's not what this is about. This is about a community coming together. So the first slide that we look at is the past 30 days of alcohol use. And if you look at 2014 12th graders, 66.7% have self-reported that they have used alcohol in the past 30 days. One of the interesting analysis is 10th graders are at 34.2%. And 8th graders are at 6.9%. These are normal trends in most communities. We also look at this data from the standpoint of how does it compare to states. And this is a normal trend, though the numbers are high. What is good about the 66% in 2014 for 12th graders is that is starting to be a downward trend from 2010 when 75% of the 12th graders or seniors were using alcohol. We can tell you that across the community, across the state, 75% of all kids will experiment with alcohol at some point. This statistic here is a good trend, and we need to continue to grow on that trend. An interesting analysis that we do, and certainly we need input from the community, is that if we look at the 12th graders in 2014, In 2012, they were 10th graders, and in 2010, they were 8th graders. In some of our research, when we have conversations, when we have these groups of grades that the numbers are really out of whack in our eyes, we ask about that particular grade. And sometimes we get, wow, that was a great group of kids, and sometimes we have, that was a group of kids that were really very passionate and very interested in learning about life, and that their experimentation was a little bit different than other groups of classes. So those are some of the things that you can do when you analyze that. When we look at the next one, which is binge drinking, and binge drinking is 5 or more drinks in an hour in the past 2 weeks. And if you look at 12th graders, we're really excited that it's down to 39.4% from 64% in 2012. That would be one of those questions we would want to know with the community. Was that group that graduated in 2012, what was the makeup of those kids? Because that is a significant drop. It's exciting that it's a significant drop. And in statistical analysis, anything plus or minus 5% is significant. 2%, 3% could be a whole host of different things. Could be blips on the screen. It's nothing significant. This is a significant drop. It's certainly 25% reduction. Good news. If you look at 8th graders, they're down to 5% from 12 2 years ago. 10th graders are down to 12. I would venture to guess that somehow kids are getting the message that binge drinking is not a healthy behavior, that it is dangerous. Most binge drinking, there are a bunch of behaviors that are dangerous that go with them, unhealthy relationships, other behaviors, and so the trends in your community for all grades are going down, and that's really exciting. If we look at the next slide.
Yes, I just want to clarify, 5 drinks in an hour?
Or like a period of time, like a sitting or an
Yeah.
instance, like so.
I believe the survey says within an hour. It's 4 or 5 drinks.
Alcohol for an 8th grader.
Well,
Absolutely, but especially for a small person.
Right.
I have to share with you, kids today are much smarter than when we were young people. Kids understand that it's illegal to possess alcohol. It's not illegal to be intoxicated unless you're breaking the law. And so kids don't want to get caught with alcohol. They consume it as quickly as they can to get rid of the evidence. And unless they're public nuisance, destroying something, destructive, fighting, then there's not an issue. The worst thing that happens is potentially their parents get called and they are picked up by their parents. Depending on where it is and the circumstances, you know, certainly I don't know what goes on when police arrive. I don't know if they breathalyze everybody. I doubt it. And so some kids get out of this because they just have been drinking. It is a lot. Someone who drinks 5 drinks within an hour would blow at least a 1.0 plus, and that includes all of us, and that's pretty intoxicated. But I don't find this startling, and maybe because we've been doing this for so long. The use of tobacco past 30 days. If you look at the downward trends, it really was a great partnership with Putnam County had a reality check program. New York State had power. New York State and the federal government did a lot of advertising on tobacco. In 2012, we had the introduction of medical marijuana. And there's an easy crosswalk for kids that if you can smoke marijuana as a medicine, then maybe tobacco isn't that bad for you. And we see that potentially in the blips, excuse me, I take that back. In 2010, they started with that. In 2012 is where you see the blip and the increase in tobacco use. And now we're starting to see the decrease again in tobacco use, because I think that the message has gotten out that tobacco certainly is different than marijuana, but that it is not healthy for you. And we'll show you some other slides that will relate to this slide in the future. But the trend is downward, except for the mixed messages that kids are getting or children are getting in the community about medical marijuana. And if you look at the next slide, you will see that in 2010, 43% of 12th graders had smoked marijuana in the past 30 days. It jumped up to 53. It somewhat has flattened out at 51 in 2014. You are seeing a huge increase in 10th graders, up to 37%. We are seeing a slight increase in 8th graders. There's a big jump from 8th grade to 10th grade. Multiple reasons. One is 8th graders normally are in a confined school setting or in a community setting. When they get to the high school, they have access to brothers and sisters and their spouses, and a lot of access then within the community. As they get older, they develop relationships in the community, and that is a tribute to kids, and we've had these focus groups where young people say, how bad can it be? It's going to be medicine. Including my own children who have asked me, Dad, maybe you're wrong. How bad can this be for you if they're going to have this as medication? And I think kids are getting a very poor message out there. And I personally am concerned if we make this into a medication issue and then into a recreational issue. One of the things that I share with everyone is that we are not opposed to medical marijuana. We are opposed to the format that they're allowing medical marijuana to be presented. And what I mean by that is there's 3% of the population that really, and again, I'm not a doctor though, I've done a lot of reading on this, I have spoken to doctors. 3% of people who have either ALS, late-stage cancer, late-stage AIDS. There are some who have epilepsy, but the majority of people who would use marijuana is roughly 3% for medication. There are other medications out there that have gone through FDA testing and clinical trials, which have scientifically been proved to support people. Currently, the bills include anxiety, psoriasis, back pain. It goes on and on and on, and in my personal opinion, I always only speak for myself, that's so inappropriate. There are other medications out there that can be prescribed and controlled by doctor. So if we have anxiety, all of us, how many joints do we smoke? 1, 2, 3, 4? There's no clinical trial to tell you what that is. If you have psoriasis, are there alternatives than smoking pot? I think there's other ways that we can do this. But for those people who have late-stage AIDS and ALS and are dying from cancer, absolutely they are entitled and deserve whatever relief they can get. So I want to be very clear that we are not opposed to medical marijuana, but not in the form that they're presenting it. It really is not appropriate.
I think that the main reason why ultimately we're concerned is because, like Joe mentioned, in some of the more common conditions, the less serious conditions, like the anxiety that can be treated other ways, there's concern that the more people that have access to medical marijuana, the more likely and the more kids are going to get their hands on it. And this has been proven in states that have had the legalization of medical marijuana for years, that those kids in the homes and their friends that have access to the marijuana. And so, like I said, the more people that are able to get the prescription, the more dangerous it is for our kids.
Wasn't there, I guess, I read someplace that medical marijuana, the delivery system, it was going to be, in some states, in a liquid form?
Well, they for epilepsy patients, they do better with the oil, not the actual marijuana. The process to get the oils is really not healthy based on
Right.
what I had seen. But there are people who would benefit from the oils. Like, a child who has epilepsy wouldn't do well smoking a joint. They need to get the THC oil out of the marijuana plants to be successful.
But in terms of being a regulated substance, wouldn't it be easier to control than say, pot, and it's more, common generic form?
Mm-hmm. You know what? I'm not sure. I'm open. I'm not sure. I really don't know. I just know that what we've seen in Colorado and other states that have legalized it, they have increased crime, they have increased car accidents, they have increased academic failure amongst young people and college students. The list goes on and on. But they're really basking in upwards of $70 million in revenue. And, they're trading, I believe, their soul for monies. So I'm not sure. And the other issue with young people who are very impressionable is they've become desensitized to marijuana. It used to be taboo and certain other things were taboo, and now it's common discussion. And the more you talk about something and the less threatening it is to someone, the more likely they are to experiment. And I can't remember if I read it somewhere or I came up with it, but one of the best sayings I've heard are that not everyone who smokes marijuana becomes an addict, and I say all, but majority of people who have smoked marijuana, most people, let me start that over.
You had it.
I had it, I let it go.
Yeah.
Not everyone who smokes marijuana becomes an addict, but everyone who's an addict at some point has smoked marijuana. And so, we need to be careful with the message that our young people get and how they're going to get involved or how we're going to engage in the community when it comes to this.
Yeah, and one of the big issues right now in Colorado that you may or may not have read is the treatment numbers, like for substance abuse treatment admissions, have skyrocketed since the introduction of medical marijuana in their state. And we also know, like Joe mentioned, the more that we normalize marijuana, the more risky it is for our kids, because we want them to have a perceived risk that marijuana is dangerous and not safe and not healthy. And the more that we normalize it in the community, we meaning society, the more likely they are to have a lowered perceived risk, and then they're more likely to use.
And you'll see
And we'll
that
get
in
to
a
that.
later slide.
Right.
Yeah.
But that's what I thought, like the difference between smoking and nicotine, like if you had marijuana available by prescription as a patch, say, make the distinction in terms of medical use
Yeah.
that you do with nicotine.
Mm-hmm. You know what? I think that makes the most sense to me. But it's just an interesting concept. The next one that we discuss is heroin, and let me just share with you that in 2014, it really was one person really had reported using heroin. But let me just tell you this. Most high school kids do not use heroin. The window for those is really the 19 to 28-year-olds. What we should be concerned about in every community is the use of opiates. The sort of roadmap for heroin starts with opiates. And it starts with opiates in that whether it's prescribed for an injury and it's misused, whether they take it from their own medicine cabinet from a family member, or they're visiting grandma and grandpa, and we all have medications in our medicine cabinet that we save for the day we might need it because we did have an injury at some point. Kids who visit other family members. Certainly when my children have their friends over, I don't follow them into my bathroom, and I have no idea whether they're going into my medicine cabinet. And I would not be missing one pill. If you have 20 in there, you don't count them. I don't know how many people count their pill. We need to take them out of our medicine cabinets, and we need to lock them up, and we need to put them in a safe place. A milligram, depending on what they're buying and the availability of it, potentially is how much they pay for that particular pill. So if the market is telling you $50 for 50 milligrams, that's what they're paying. Usually we start out by stealing them or taking them. We buy them when we run out of money, and depending on how hard their addiction is or how much they've evolved into their addiction, they steal from people. They steal from their family members. And then their provider, who is a dealer, says to them when the person is saying, you know, I don't have any money, but I need something, I need a fix, I got the itch. A bag of heroin is $10, $15 at worst. And the issue is not the progression. What the issue is when most people are overdosing is that they've either stopped, have gotten clean for a period of time. It kills me when I hear people say, oh, they got a bad batch of heroin. I don't know what a good batch of heroin is. It's rather foolish, the language that we use, and we don't even realize it. And our kids, whether we want to believe it or not, hear us. And we're models for them. And we model every day for children, whether they're ours or someone else's. And we can fib to ourselves all we want and say, that's not true. It is true. They're watching us. They watch how we dress. They watch how we talk. They watch our mannerisms. And if we talk about substances matter-of-factly, or that it's okay, then that's how they're going to think. And so we really need to do a good education within our own homes with our kids, in the community with our kids, about opiates and the dangers of them. If you look at opiates, it's an unforgiving drug. I'm not suggesting that you can smoke pot. I think it has brain development issues, it has academic issues, it has whole relationship issues, it has a whole bunch of issues. But marijuana is an unforgiving drug. Heroin and opiates are not. And there's this discussion of the first time you ever use an opiate, and that it grabbed you right by the seat of your pants, and there's a documentary out there called Chasing It. And it's about the first time people have shot heroin. And it just is what they chase the rest of their life because it was so good to them. And it is so dangerous, and it's unforgiving. So we need to really have discussions about opiate use for the younger kids, and then we need to do a discussion for older people with heroin. It used to be a drug of the poor. It used to be a drug of people in inner cities. It's now the drug for middle-class white people. Kids, boys, girls, doesn't care. And it is a scourge. It is horrible. And I can tell you from my professional experience that I get at least one phone call a week, sometimes two, from parents that are just crying for help for their child. And we do everything we can to help them. And it's really, we need to do some sort of education in the community to continue to address this.
One of the things we're hearing from treatment providers is that's very unfortunate and sad is that there are many people that go to treatment and that recover, which is great, but then they go back into the community and they use just one time, but they use at the level they were using before they went into treatment, and that's unfortunately where they lose their life. So that's something that it's important that people understand that because it's very serious, and that's where some of the tragedy is occurring.
It shocks their system, yes, ma'am.
Mm-hmm.
I was just going to say, the year 2012, do you have any insight into what was going on? Because they've been the highest in almost every substance. Do you have any
I don't.
insight on-
We have no insight into why it was two. We have no insight into that. You know, one of the things that we talk about that I think is important is, you know, heroin kills, opiates grab you, and as I said, is unforgiving drugs. The percentages are small when you compare it to alcohol and marijuana and other drugs. The problem is it's so final and so destructive to families and communities that, you know, I don't want that to be that one person. I don't want it to be my child. I don't want it to be anyone's child. It's horrible.
But would some say the onset, resulting in the 2012 statistic was the push for the prescription drug use, the over-advertising, the over-prescribing starting in 2009,
8, 10, yeah.
And then it resulted in, okay, we're not getting prescription drugs anymore, we're using heroin, and that was the age group of kids, I think, in 2012. I mean, just to bring it a little close to home, I think it was 2011, 2012. My husband had surgery, he came home, I had a young neighbor visit. It was uncommon for her to just stop by and visit, but it was okay, we walked our dogs together, and I was curious, but she asked me, can I use your bathroom? I said, sure. She knew my husband was had surgery. Then she came out and she said, can I use your upstairs bathroom? Luckily, at that time, without even knowing, this hadn't hit our community yet, and not even knowing, I never kept anything in the bathroom. Unfortunately, a year later, she was dead. And that was the onset of, that was the first in the community, and then it just spiraled, and now we have, it's... So is that kind of when that became 2008, 9,
Nancy, I think it's a complicated issue. One of the factors is pharmaceutical companies and the introduction of new medications. When OxyContin first came out, it was called like heroin in a pill. There's a lot of things going on attempting to reduce that. One is in New York State, they have this program called iStop, which doctors are supposed to, before they prescribe medication that are opiates, that they go online to verify that the person doesn't have any other medications from another doctor that's similar, because people doctor shop. The issue, though, is that it's in New York State, it's not in Connecticut. We're a stone's throw from Danbury, and someone can easily have a doctor here and a doctor in Connecticut, and there's no way that anyone could ever verify that that's going on. And the pharmacist who fills the prescription, as part of that, is supposed to go online and verify that the person doesn't have other prescriptions from other doctors that overlap or conflict with what was just given. And so there are some things that are taking place. I think that we need more education for healthcare providers. We need more education for treatment providers. We need more education for parents. Opiates, if taken for, and my memory is a little soft right now, I don't remember if it's 14 days or 21 days straight, potentially can have you addicted to that particular medication. Most prescriptions are for 30 days, 60 days, and 90 days. I believe they're stopping or have stopped the 90-day prescription, that you have to go back to your doctor to get it refilled. But if you think about that window, we need to do something about that as a society, because we're just encouraging then things to spiral out of control.
So we do hold medication take-back days several times a year, so you can look out for those notices. That's a great time to empty out, your medicine cabinet, raise awareness about prescription drug abuse. We also, during the springtime, go to each pharmacy in the county and have what we call point-of-sale materials placed on the counter. And that just means that as you come up to pick up your prescriptions, there's educational materials about prescription drug abuse right there on the counter for you to take. So we do have great partnerships with the pharmacies. We do that every year. So.
Does the pharmacist have access to a database that's just for New York, or is it Connecticut?
Just New
Just
York.
New York.
Yeah, not New Jersey. And they may have their own, but there's no link. I don't even know if they have their own program for that, but there's definitely no link. The next slide is the overall 30-day use of other drugs. And again, though these are small percentages, and the trend for other narcotics is going down, which is a good thing. Sedatives are going down. Amphetamines have stayed flat. This is concerning because these are the beginning steps to other drug use, or these are steps to being abusive. And for people who are using other drugs, amphetamines, sedatives, they don't want to become addicts. They're not doing this and then saying, yeah, I'm going to be an addict today. It grabs you by the shorts and doesn't let you go. And you continue to spiral out of control. Yes, sir?
Is there any correlation between like amphetamine use staying flat and with the frequency of it being prescribed?
We've not been able to do any of that research, but that's a good question. The other thing that we've done is to the right underneath the box of the dates, the legend. We've given you examples of what amphetamine, sedatives, and other narcotics. And it's not surprising that the amphetamines are high. Kids are sharing, and kids are abusing their own Ritalin and other things. And they have, and I don't know specifically about this community, but we do know that kids have what are called farm parties or skittle parties. They go to a party and they throw medication in a bowl, and kids get together and just grab something out of the bowl, and they're getting high that way. The problem is if they're on a particular medication and they take another medication, it could have a synergetic effect for them, and it potentially can be deadly. And so we need to really be aware of parties, and I know everybody wants their kids to be, to have a good time, to have a party. Parents want to be friends with their children. They want their children's friends to like them. That's not the way to go. And, hosting parties and allowing your kids downstairs unsupervised with all their friends, not a great idea. Thinking that you're going to have a party and you're going to take their keys and they're going to be at your house and they're going to be supervised, not a good idea. Kids have spare keys. Kids are smarter than we are. They put their other key on top of the tire. I can tell you in the past 10 years, at least three or four kids who have left parties at 3 in the morning that the parents took the keys and they died in a car crash. And so I'm not even suggesting you shouldn't have a party. You should have parties because you know what you're providing and you're there for supervision, and every once in a while you should go downstairs or upstairs and, hey, I made some cupcakes, or I got some other sodas, or they're going out the back door and they're going to the woods or their car, and it's horrible that we need to be the party police, but you know what, that's what we have to do. And your thanks will be sometime later in life when your child's 40 or 50 or 60 and they got it and they say thank you for all you did. And if you expect something sooner than that or something different, you're missing this. It doesn't happen that way.
Also, too, a little story was when we worked with a parent from a different district years ago. She told us that she had dropped her son off at a friend's house and a little while later decided to make brownies and bring them over and returned with the dessert only to find the parents intoxicated at the house and the kids were unsupervised. So that's an example too of just being really important about knowing your kids' parents and their expectations and kind of what they're like in their home. So she was very glad she went back to the house and discovered mom and dad to be intoxicated there, and took her son home. So that's a true story.
Yep. The next slide is the onset, and these have basically stayed flat. There is no significant change. Certainly, I can tell you for alcohol and marijuana, the longer you can delay a child's use of that particular drug, the less likely they are to have an addiction later in life. And the sooner that young people start to engage in these behaviors, the more likely they are to have an addiction later in life.
I think the statistic is you're 5 times more likely to have an addiction if you use alcohol or marijuana before, or especially alcohol, before you're 21. Mm-hmm. So,
right.
than if you wait.
And I don't think any of us expect our child to get to be 21 years of age and not to have had a drink and experiment with alcohol. Marijuana is a gray area depending on how you present that within your home. And tobacco certainly is the same way. It's a little easier to detect when your child's smoking tobacco because of the odors that come through with that one. Yes, ma'am?
So the age, the lowest age is 13.2. Does that mean of the students?
That were surveyed.
Was age 12 given, or?
No, it's up. We do 8th graders now. I don't, my kids are grown, so I'm a little lost. I don't know what grade how old you are in 8th grade anymore. Are you 12 or 13 or 14?
But even if you're 16, it's how you answer the question.
Correct.
Yeah, so were they asked to go back and recall when they started using alcohol, tobacco, and marijuana?
Yes.
Yes.
So when they went back, none of them reported for 13 point?
Correct. Or correct. Correct. If you surveyed a group of 7th graders, you might get some responding, by the way, who have used already any one of those 3. But we only do 8th through 12th. Now I understand your question.
Okay.
Perception, we're seeing a increase in alcohol perception risk from 78 to 84, which is 6% from 2012 to 2014. Tobacco has stayed the same in the high 90s. The perception of risk is down to 46% for marijuana.
Right. So this goes back to what we talked about earlier. This is very serious.
That's less than 50%. That's 4 out of 10 kids. 6 out of 10 kids think it's no big deal. That's a scary thought. The next slide is perception of parents. And this is the child self-reporting that 97% in 2014, wonderful, that they believe their parents disapprove of alcohol for them. 96% of tobacco, and just about 80%. That means 20% believe their parents believe it's okay. Now, here's what the tricky part of this is. I believe, and I've not met very who don't, I think parents love their kids to death. I think they want their kids to be happy and healthy and successful. And the issue is sometimes when we talk, we don't always express ourselves how we want it to come out. And as I said earlier, we are models for our children. And they listen to what we say. And today, when some of us were kids, I'm going around you, our parents said, do as I say, not as I do. Kids don't buy that today. They're too smart. You can't say that to your child. You can't tell them, don't drink and drive, and then you get drunk and get in your car and go pick up someone. They know it. And so when we talk to parents, or when we go to programming with parents, or we have family universities in other communities, we really specifically work with them about communication skills with their child and modeling and what's acceptable behaviors. And sometimes not saying anything is passive consent. If you don't say no, it means it's okay. If it's not a rule, then it's a gray area. And you really can't have gray areas when it comes to addictions. Okay. Next is kids, again, self-reporting. 56% believe that laws and norms are favorable towards alcohol, tobacco, and other drug use. We need to, tighten that up wherever we can, whether it's in legislation or with our local law enforcement people. Availability. 64% believe all of those are readily available, that they have access to it in the community. And 47 believe, and it's a downward trend, that 47 believe that their parents' attitudes are favorable towards alcohol, tobacco, and other drug use. Again, That's the communication skill. What is the message a child is actually getting from their parent? I don't know, I've met a few, I don't know many, and so a few means less than 1% who say, yeah, go get drunk, I don't care, or go get high, it's okay with me. I don't know very many that do that, but I do know people who model different than what they preach, and kids don't buy that. And so we need to figure out our communication skills with parents and children. And then the next one, these are what are called protective factors. There's risk and protective factors. The more protective factors a child has, the less likely they are to engage in risky behaviors. The less protective factors and the more risk factors, the more likely they are to engage in risky behaviors. Some of these are things we have control over. If you look at family rewards, almost 60%, it's a little bit on the increase. You know, and family rewards are the child's self-belief role in the family. Most of us, when we go on vacation, all right, we're going to Florida or we're going skiing, pack your bags, you want to bring a friend, that's okay with me, we're going. Kids want to have a say, and you can want to go to Florida, but maybe you should, around the dinner table or wherever you engage your family, say, all right, we have vacation coming up, where does everybody want to go? They need to feel appreciated, they need to feel that they have a voice, and they need to be part of that. And that's one of the simple things we talk about with family rewards, or recognizing them for some outstanding achievement, volunteering, or whether they do well academically. And I say well academically, that doesn't mean 100. It means we have to accept where our child is, and 80 might be great for them, and that's great. And they're putting the effort in. Academic achievement isn't about hundreds for everybody. And then the other one is community rewards. Well, what does this community do to recognize their kids, if anything? But almost 70% feel recognized in their community. And then the school rewards, which is pretty good as well, is in the 60%. That's been kind of flat. And those are things that the school does, whether it's luncheons or programming that they provide for the kids. We have to dive into that because they're... what we learned in another community is, you know, some of them say there's not a lot to do, and then when we figure out all the things that are in the school, it's not things that they want to engage in. And so we need to figure that out. And again, we can't cover everything.
Yeah, we want these numbers to be as high as possible, so we're pleased, like Joe said, that they're all increasing.
And then the last two slides, the next one is on gambling, and it's part of the survey. We're required to do that. Through the council, we have services available to come in schools, to come in the community. Parents can reach out if they feel their child gambles too much. People that do gamble, I've seen people who go to the horse races with their family and they have a ball and they're dressed appropriately. If you're betting the lunch money and your mortgage money, then you may want to look at what are you doing and what are you teaching your child.
Right, and we're really concerned about underage gambling because it's very much so associated with other risky behaviors like alcohol and drugs. So that's our main concern. But we actually are very pleased to see these trends, these downward trends.
Why the spike in 10th grade though?
I don't know. I know. I see that like 10% increase.
We're not sure.
Not sure.
We have not really gotten into this because we're not sure how yet to get into it.
Yeah, we do have problem gambling prevention programs, like Joe said, through the council, through where I work, and we are in the schools. We were actually at Haldane last spring. We worked with all the 8th graders and did a presentation and tried to involve them that way, but we're not sure why the 10th grade spike, is there.
And then the last slide that I want to talk about, and this one, we've done focus groups, and it's an interesting statistic. In 2012, 6% of the students reported that they had driven in the past 30 days while intoxicated. It's down to 1%, which is really a great trend. I'm still worried about that 1%. It's the next one that bothers me a lot. 21% in 2012. It's down to 15% in 2014. And when we ask kids, why would you get in the car with someone who's been drinking? And sometimes they say because they were more sober than I were. And other times their decision making is poor that I really needed a ride. I couldn't, my parents weren't around, or my parents wouldn't come get me. And we need to, as a community, embrace when our kids call us when they want to ride because someone else is drunk. And we should love them to death and thank them for having the courage to call us. But kids tell us, I don't want to get in trouble, because parents often hold their kids responsible for their friends' behaviors, and that's wrong. If you allow your child to go with someone and the person that they were with is driving and was drunk and they call you, you should say, hey, I'll be right there, thank you. Not, I told you that person's no good and I can't believe you're friends with them, and how dare you, what's wrong with you, and blah, 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 blah. Your kid already has dead fish eyes, they're not listening to you. And we continue to pound them, and it's really inappropriate. We hold them accountable for their behaviors, not someone else's. The only other thing I want to add, and we may have to take just a 2-minute break, and then we'll come back to questions, is, with our children, and it's one of my really favorite sayings because it makes a lot of sense to me, is, if you hang out in a barber shop long enough, you're going to get a haircut. And if our kids are hanging out with people who are drinking and drugging and doing risky behaviors, at some point they're going to do the same thing. And as Kristen had mentioned earlier, you got to know your kids' friends, and you got to know who their parents are and where are they and what are they doing, and you have to be steadfast in what you believe. So just give us a 1-minute break, and then we'll come right back. We're going to offer people, if you want to ask questions, please come up to the microphone so it can get recorded for the public. If there are no questions, certainly we'll stick around for a little bit afterwards, and you can come talk to us, but certainly we're open to any questions you might have or suggestions. Come on up here.
I just wanted to say thank you to Lourdes and the PTA, and to Dr. Bowers, and to Joe and Kristen for coming out and working so hard with our community. This is the second time that they've made this presentation. It's a really good thing. We had 60 people here the Friday before Christmas, and you're all back here, and it's being videotaped, and that's a wonderful thing. There's something about the New York State host law. That's the name of it, right?
The social host.
The social host. You talked about the how it hurts the kids, but there's also legal
Sure.
Consequences to that, which is it 1 year in prison?
Sure. Well, what we did in 2007, because there were a lot of parties being hosted by parents and there were deaths in the community, fortunately was able to go to every town in Putnam County, and we passed a host liability ordinance. We had researched it. It was modeled after what they did in San Diego. And each town in Putnam has a host liability ordinance. It's a local law, it's not a state law. And what it says is if any person hosts a party of 3 or more kids, 16 years of age and under. So any of you are going to ask me, what if my kid has a party and I'm not home? They will be held accountable. It is punishable by up to 1 year in local jail if the judge so sees so fit. It's a misdemeanor, and we've had 4 cases in Putnam County. One particular person is facing 50 counts of endangering the welfare of a minor because there were 50 kids that were caught. There was more kids there, and they ran, but 50 got snagged. It's a $3,000 fine. And in addition to any civil penalties that you potentially will face if someone is hurt, the local government or responders, whether it's ambulance, stat flight, police, can then hold you accountable for the cost of those expenses to respond to that particular party. We have had 4 cases. 4 have been prosecuted. One particular person was a nurse and lost their license to support their family and their professional endeavors. And we take it pretty serious in Putnam County. And so when we do the prom presentations in some of the schools, we do that presentation. We have judges and attorneys who come with us who present the law, and it's amazing to watch parents mortified, not knowing that this takes place. And in 2 of the schools where we ask the child to come with their parent, it's so funny to watch a parent elbow their kid and say, "I told you so." And so it really is a great law that we've been able to enact to support not having parties in our community for underage drinking.
There's a follow-up to that, because there's some confusion, too, about family parties or birthday parties that you have, where there's both adults and kids there, and you're having liquor available to the adults, but there are underage teens. How does that work?
Well, as long as the young person at those parties aren't drinking and people are responsible, it's fine.
Okay.
Police do need to have some sort of probable cause to go in a home. If it's quiet, they have to be invited in. If they open the door and talking to the person and there's people laying down, there's probable cause. Okay. There's solo cups everywhere. But unless someone calls the police. But one of the things that we have partnered with our sheriff's department on are parties. And they will accept phone calls anonymously. You don't have to give your name. Hey, I know there's a party this weekend. Here's the address. What they have done is send police over to the home, knock on the door, say to the parent, "I understand there's a party going to be at your house this weekend." And usually the parent says, "Really? We're not going to be home." And it's their child who then tells one kid, and their social network is really big. One turns into 1,000 before you know it. But that also gets information out. And people are entitled to be safe, and so you can call the sheriff's office anonymously and let them know about a party, and they'll go there beforehand. They're not looking. This isn't about catch and punish. This is about identify and help, and one of the ways that they're our partner is that they'll go there first before there is a party. So yes, great, thank you. One of the things that we've talked about in 2 other communities that had sports associations, that have sports associations, they didn't have them, they have them, is they would have year-end parties for their baseball teams. And they would have a bullpen, and the bullpen had alcohol. And through the coalitions on the other side, on the East Coast, we would talk to them about modeling, and that why do you have to have alcohol at your parties? And you know what? They stopped it. And the first time, they got some flack from people who were coming. Hey, where's the beer? Where's the bullpen? And then the next year, less, and now it's routine. And when we teach kids that you have to go somewhere to a barbecue and you have to drink as an adult, and you're modeling, that's what they're growing up with. And we're not saying, we're not a prohibition, but what are we teaching our kids and how are we modeling for them? So those are some things that we could all do. Try having a party at home for your family with no alcohol. I tried that one. It went really well. Any other questions that anyone would have? Great. We want to thank you so much for coming out. We'll be happy to stay after, talk privately if you wish. We look forward to working with the community. You guys are great. You really, your enthusiasm is catching for us, and we're excited, and thank you so much for your time.
Yes, you can visit putnamncadd.org, and that's how you can see what we're doing, access our social media that way, and you can also see...
on Facebook.
That's true, yes. You could like us on Facebook, and we do regular updates for parents several times a week. We also have a blog that's updated weekly for parents. And we also have a coalition in Phillipstown. So anyone is welcome to join, and you could talk to us after about that.